Hello, and welcome to the Functional Nurse Academy podcast. This is your host, Melissa Schreibfetter, owner and founder of the Functional Nurse Academy. Welcome, everyone. I have another wonderful guest with us today. I absolutely love to use this platform to elevate the voices of nurses who have really shifted how they practice and are spending their time in advocacy and education and helping others. So I am so honored to be joined by Hayon, who is a registered nurse and a former ER and travel nurse. She is the founder of the Realistic Nurse. After experiencing seizures, medical gaslighting, and even being fired following a patient assault, she decided to leave bedside nursing and healed herself through lifestyle interventions when the medical system failed her. Now, with 110,000 plus followers all across social media, she uses her platform to expose what she calls the sick care system, the business model designed to keep patients sick and nurses broken. Her message to exhausted healthcare workers and anyone failed by conventional medicine is, you are not broken. You were trained to break yourself. Ali also hosts the Realistic Nurse podcast and works as a clinical lifestyle coach, helping people escape the cycle of symptom management and reclaim their health through root cause education. Welcome, Ali. It's so great to be here with you.
Thank you. Thanks so much for having me, Melissa.
Absolutely. Yeah, I was so excited when I had another nurse friend that showed me your social a couple of months ago. And I was like, who is this nurse? How have I not heard of you? But I just think that you're doing such great work. And I love it when I see other nurses wake up and then they use that experience to help others. And I am super interested in your story about how with the seizure disorder and then you healed yourself naturally, which I think is so impressive. Can you start off by telling us about, what was going on in your career as a nurse, like around the time that you were diagnosed with this seizure disorder?
Yeah, so I was travel nursing. I was on night shift in the emergency room. And if anyone has ever travel nursed before, you have a 3-month contract usually, so 3 to 6 months that you sign, and you can stay or you can keep moving around and trying new hospitals and seeing new places. And I genuinely loved it. I loved travel nursing but it was stressful. You pick up, like, nursing itself is already a very stressful job. And travel nursing puts a little bit more stress on an individual, especially for nurses. And so one night I was working at a trauma center and I had a seizure on night shift. And luckily, I was traveling with my partner. He traveled with me and he was also a travel nurse. So he was able to assist me that night. I was in triage. So I was triaging a patient and I got really bad tunnel vision. I couldn't really hear the patient talking to me, what they were saying. So my travel partner came and helped me to a chair, and that whole night I had seizures all night at that hospital. They checked me in. First time ever, never had a seizure before like that. And they ended up having to intubate me. They, at that hospital, did an EEG. They found epileptic waves, and so they had to transfer me to a higher level hospital that had epilepsy monitors for the seizure activity that was happening because this hospital didn't have that. And so for days, they tested me for meningitis. They gave me all these seizure medications. They threw antibiotics at me. They didn't really know what was happening. I was just status epilepticus, just rolling seizure after seizure. And once I woke up, they said, we didn't find anything. Your blood work looked fine. We did multiple MRIs. Your initial MRI showed a little light in it. So we did another one and it was gone. So they assumed that was the seizure activity on that MRI, but no answers. They gave me Keppra, which is a anti-seizure medication. And then that was my first introduction to the medication trail. So they gave me Keppra, and then they gave me an anti-anxiety medication because Keppra causes anxiety. And at that time, I was already on an antidepressant because I was struggling with depression. But at that time, I wish someone would have told me, you're going to go through struggles in life, and maybe that pill wasn't the answer. But yeah, that was the start of my journey. I was on an SSRI, I was on an anti-anxiety medication, and now a seizure medication. And it all unraveled after that. I kept having seizures. I was unable to work. And eventually, after I took some time off work, I took probably a few months off, I got the seizures under control and I was ready to go back to work. And that's when I took another contract. So I was still travel nursing. I took another contract and I was in triage again. They seem to like to put travel nurses in triage. But a patient was upset with me because our back was completely full and they were in pain. And I said, I apologize. We're doing the best we can. We have to do a triage process where it's just the process of the hospital. This person got really upset and just took off their blood pressure cuff. And blood pressure cuffs aren't hard, but they're pretty, you can use it as a weapon. They smacked me with it and just kind of threw the cuff and walked out the building. I must have sparked my nervous system somehow because I had a full-blown seizure after that and had to go home the next day. The hospital, my recruiter called my travel partner and said the hospital cut Allie's contract because of the seizure. And
I
that's,
am
yeah.
so sorry. Like that is just, and thank you for sharing that with me, but that is just a prime example of how the hospital system mistreats nurses. And we can put so much of our time and effort into that system. And then at the end of the day, I feel like we're just a number to them. So essentially, you develop the seizure disorder. After a few months, you're able to get back into work. And after being assaulted at work, which again, we know that extremely stressful events like that can absolutely trigger a medical event in someone who is vulnerable. So that triggered a seizure. You seized at work, and then they essentially fired you. Am I hearing that correctly?
Yeah, yeah. And when I tell this story, people are like, "You're leaving something out." I'm like, "I'm really not. That's just how it happened." And it's so true that you say that the hospital system is abusive to its nurses. And you
Well,
have these VIP patients that come in of, executive family members. It's like, why don't you take care of your nurses who are actually some of the most chronically ill people because they spend all their time taking care of other people and probably don't fully understand how to take care of their bodies in these stressful situations, which I found myself failing at essentially.
Well, and again, the system is so incredibly broken, and there are so many nurses leaving the system, and the system still does not understand what they need to do to support nurses. I mean, it just keeps getting worse. And I will say, when I started working as a nurse, I have never seen anything like this. I have never been worked like this in any other profession. I haven't even heard of other professions that treat their employees this way. So now, what happened after that? So they, which I believe is absolutely an unethical fire. I think it's just awful what they did to you. What happened after that? Like how long did it take you until you were able to start seeing some benefit with your seizure disorder? I know that you mentioned that you went through a lot of gaslighting in the healthcare industry.
Oh, so much from every angle, not even just doctors, the hospitals, my coworkers, everyone. But um, so after the assault, I was still having seizures, but I stopped working. So that was kind of a nice moment for me to just be like, okay, let's figure this out. But the seizures just kept getting worse. I was on double medications now. I was on highest dose of Keppra and another anti-seizure medication now. I was on the anti-anxiety, the depression medication. They actually kept switching my antidepressant medication because it wasn't working. So my brain was just all over the place. And I was seeing epileptologists. So at this point, after that assault, I had seen probably 3 or 4 epileptologists, and they specialize in epilepsy. And I was told by one of the doctors that I started seeing consistently where I live that with my track record and with what they've been seeing happening, I was on track for being at risk for sudden unexpected death in epilepsy patients. And apparently that's a thing. I never knew this. I didn't know that 1 in 1,000 epilepsy patients die in their sleep for an unknown reason. But where it started getting really frustrating with the medical system was I would have those kinds of conversations with doctors, and they're saying this is really serious. We have to really keep an eye on this. I would have a seizure. I would end up in a hospital. They would give me a lot of medication. So for seizures, they give Ativan, which is a sedative, which turns your brain off, basically. They gave me all these anti-seizure medications, and then they would hook me up to an EEG machine, and nothing would show up. I would be out for 24 hours. They would monitor my brain and nothing would show up. So then I would have doctors telling me, you're just having spells. And they would tell my partner, they told him, you can just let her seize. It's okay. These are just spells. So one day we're at the epileptologist. They're telling us she might die in her sleep. She might die having these seizures. And then probably days later, I would have another doctor tell me, this is just, you just have to let it happen. It's okay. And then I would ask, so why am I on all these medications? I don't want to feel this way. These medications make my brain feel like it's vibrating in my head. Like I hear a low hum 24/7 because my brain isn't working right. And you're telling me I don't have seizures. So why am I taking seizure medications? And then they would say, oh, no, you have to take those medications, but it's okay to have seizures. And then I would go to my epileptologist maybe a couple weeks later, get an EEG done. I had a seizure in the office and they caught it. And the epileptologist sent me to the hospital, told the hospital to put me in the ICU because I was in status epilepticus again. And I got told again that I wasn't having seizures and that, basically kind of like it's all in your head. Like these might be pseudo seizures, and my partner, he's been a nurse for 16 years, and he said, you can't tell me these are pseudo seizures. ER doctors don't intubate people for pseudo seizures. And I'm so lucky I had a patient advocate because I wasn't in my right mind to say anything. I didn't know what was going on. I'd wake up so confused and have all these different answers and people pulling me in different directions. And that's another thing. It's really important as a patient in this medical system to have a huge patient advocate, someone advocating to make sure you're getting the right care and to make sure that doctors, because some doctors, they don't really want to listen to you. They think they know what they know, and that's final. And I think that could have really hurt me.
Yes, and that is something that we're all advocates here. And I did want to put a plug real quick for Kimberly Overton. She actually created an organization, Remnant Healthcare, where they actually have nurse advocates that can be of service if someone is in the hospital or is navigating some type of chronic health issue. But yeah, I think that you're right about so many of these positions. I think a lot of people do go into nursing or medicine with many times with the right intention. But I do think that so many people get burnt out to the point that they just lose compassion. And I also, so our listeners, we have a lot of nurses and other healthcare professionals. We also have people that are not in healthcare, but they are super interested in health and wellness. Could you describe to our listeners what exactly are pseudo seizures?
Yeah. Pseudo seizures can actually be many different things because seizures are basically misfiring in the brain. Something is misfiring. So you have epileptic seizures, meaning that there's some sort of electrical issue going on. That's why they can measure it through the EEG. Pseudo seizures can either be a psychiatric problem or just any other issue going on in the head that they haven't really figured out as a medical community. And so they call it a pseudo seizure. They also call it PNES. That's a different way of saying a pseudo non epileptic seizure. And basically, with how I found out how mine was working, was I had both epileptic and the non epileptic pseudo non psychiatric. It was all physiologic um, seizures. And the way I describe it is the nervous system is completely dysregulated. The nervous system needs, sorry, my brain. um, the best way that I learned it was I needed to figure out why my nervous system was in fight or flight, figure out what I was putting in my body, what I was doing with my body. So on night shift, my circadian rhythm was completely off. And no doctor ever asked, how's your sleep? How's your stress? What are you eating? Are you seeing the sun? I wasn't getting any sunlight. I wasn't going outside because I would get off in the morning and I would go to bed. And then I would wake up at night, go to work. I'd be under fluorescent lights all day. And it makes sense that I was having these seizure-like events. And it also took me down the road of, did the COVID vaccine cause this? Because I had to think of everything. I got the initial dose. I was fine. I got the second dose. I was fine. But to continue travel nursing, I had to get the booster. And that's a few months later is when I started having these seizures. So I just had to go down the line of what could be causing this in a supposedly healthy 28-year-old. What caused 27 years old? What caused these? Because no teacher, no doctor could even tell me kind of why. Like, I would just say why, and there would be no answer.
So I worked in the psychiatric field for quite some time. And I do remember this was very common with individuals that I worked with where I felt like the seizures were dismissed and they were like, oh, it's just a pseudo seizure, which some healthcare professionals really do believe that a pseudo seizure, they believed that some of these patients were faking these seizures. And I have seen some of these seizures And I'm like, the person is not faking this. And I think that it is so just, I think it's so damaging, to these individuals that are really suffering. And, the medical field doesn't have an answer for them. And it's like, no, we're not going to look to investigate it. And I also think it's really interesting that this was occurring when you were working night shift. And, we know that the studies are really clear on this, that night shift workers, even if they are getting adequate sleep on their days off when they're off duty, being a night shift worker does increase the risk for multiple different diseases. And there are some individuals that are just more vulnerable to this. But, it is just, it's just amazing to me that we have specialists that supposedly specialize in seizure disorders, but the only tools they have are medications, which have very serious side effects too. And I know in functional medicine, one of the things I teach are the 8 foundations of wellness, where we're basically going through your gut health, your digestion, your toxic load. How are you sleeping? How's your stress? How's your environment? All of these different things, because there are things that affect the body. And when the body is dysfunctional, there's something causing that dysfunction. So, yeah, it seems like I mean, your care just, it sounds so dismissive to me. And when did you start to seek answers on your own with this condition?
Yeah. Well, the more I got dismissed, the more angry I got because it was extremely frustrating because I had no life. I had no job. I couldn't go a day without a seizure, and it got to the point where my brain, I don't even know how to describe it. It felt robbed from me. It felt like it was taken from me. I couldn't think for myself anymore, and I had a day where I just broke. I said, I will not go one more day with these medications. Like, I'm still seizing, I'm still, being gaslit, I'm still, all of the above is still happening. So if I stop these medications, what's the worst thing that could happen? This will still be happening. So I wanted to just cold turkey them, but my partner helped me taper off a little bit because that would have probably been pretty destructive for my body to just completely take away very high dose seizure medications. And I got off the antidepressants, and I started really looking at my health. What am I eating? I was a fairly healthy individual. I ate what I thought was healthy food, but turns out it was all processed, just marketed to me as healthy. So I would drink protein shakes, these already made Premier protein shakes that had 50 ingredients in it, and those kinds of things that I thought were healthy. But I would also be eating fast food at work. I would be eating whatever was available to me or what was at work. And during this time, I started seeing influencers online talking about our food system and how that was affecting people in their bodies, and just the inflammatory process that was happening with our food. So I started becoming more aware of that. And no doctor ever told me anything about food. And you wouldn't think that, oh, food will change seizures, but I started looking it up, and the ketogenic diet is like literally everywhere online. If you just look it up, any sort of diet or how do I heal seizures naturally? I think that's how I Googled it, and that was the first thing that came up. So I started trying to incorporate more fats and, protein and less bread. And I thought it was basic, but it goes deeper than just, eating healthy. It's learning how to nourish your body is what I had to do. I kind of had to become a baby again and learn how to feed my body and realize that that could play into what was happening because our gut and our brain is connected. And I had no idea. I had no idea that all my neurotransmitters were basically in my gut. And maybe that's why I had depression too. Maybe that's part of my depressive problems because I'm off all these medications and I don't have these symptoms as often. I don't struggle with depression. I have points in my life that are difficult and I struggle, but I know that that's part of being human.
Yes, and it really oh, oh gosh, I know you guys hear me gripe every single week, but I just can't help myself. It is unbelievable, and I'm kinda like, okay, for specialists who specialize in neurological disorders and brain disorders, how do you not understand that neurotransmitters are produced in the gut? Like, I just don't know how this happens. How do you not understand that the cranial nerve, the vagus nerve, connects the gut and the brain? And then again, when I used to be a psych nurse, I remember so many of these individuals that were suffering with mental health issues. They almost all had gut issues. And I remember there was this one patient, she was had consistent severe bloating. And the doctor was like, "No, you're just fat." It's just like it's so bad. It's so bad. You can't make it up. And hearing these stories, I'm like, I know I need to be positive because I do think that we need to integrate both systems, but this is so it's so unbelievable. And I feel so bad for the individuals that just don't have the knowledge or the resources to be able to advocate for themselves. But yeah, we're going to dive more into how Allie worked to heal herself after the break. But we do need to cut real quick to break. So before we cut to break, I do want to remind our listeners, if you are a nurse that is fed up with sick care, I can absolutely train you. At Functional Nurse Academy, I offer the most comprehensive training on the market, specifically designed for nurses, where nurses can learn functional medicine and can also receive business mentorship to launch their own independent functional medicine businesses. They also earn 90 nursing CEs and board certification eligibility. So make sure you check out functionalnurseacademy.com. This show is also syndicated on America Out Loud Talk Radio on the Nurses Report radio show and podcast. So you can also find me there on any major app. Hello and welcome back. This is your host, Melissa Schreibfetter, and I am joined today by Allie, who is also the founder of the Realistic RN, and she is sharing this amazing story of how she went through a medical gaslighting in the system with a seizure disorder. And we were just talking about how she was not receiving good care on the conventional side. And then she started taking things into her own hands. So again, right before we went to break, I was griping about how ridiculous the system is. So I love it when nurses we can go through this experience. It's one thing to be a nurse and we're working with suffering patients. We see that the system is broken, but then when things turn around and then we're the patient and then we experience it firsthand, and then you must do something about it. So I love that that is what you are doing now, and you're using your platform for so many good things. But I would love to hear about your journey from, having to be on the SSRI and the anti-anxiety and like the max dose of the seizure drug. So we were talking about how you started learning about food and you started slowly titrating off of your medications. So what other interventions did you use to heal yourself, or was it primarily the ketogenic diet?
So I started with the ketogenic diet and I was seeing progress. Like I not only felt better, but the seizures were getting way less. I also was out of the environment of nursing. So I started figuring out, I guess you would call them triggers. So just things that my brain and gut were just telling me no. So the travel nursing I had to stop because of the constant stress, constant trying to find a new job. And then I started eating ketogenic diet, more whole foods as well. So mostly just sticking to what's grown from the earth, what's given to us animals, and trying to find more locally farms, and I buy my eggs from farmers. I'm just trying to get the industrialization out of my gut because I realized that that is where all my neurotransmitters are. That's where my brain functions from. So I was just trying to eliminate anything that I thought was a toxic trigger. So after I did the ketogenic diet, I actually started doing more of a carnivore. I at that point I was completely seizure free. I got off all my medications, and then I started trying to regulate my nervous system, which I never really learned how to do as a nurse, which I wish I learned earlier. But I would go outside and see the sun every morning. I would make sure that I sparked my circadian rhythm and got that back in check. So I would go outside and sit for at least 15 minutes in the morning, and then I made sure that I moved my body. I was walking every day and doing low impact, nothing that would excite my nervous system because I thought maybe my nervous system's too excited. Everything that was in my past kept me in a fight or flight survival freeze mode. So either I was in fight mode, I was in flight mode, or I was in freeze constantly, is what I was realizing. So just pulling myself back to a slower paced life and removing the stress. I did a lot of cold therapy. So I would do cold showers, I would do cold baths just to shock my nervous system and try and control it that way. So any sort of crazy feelings I got, because once I got off the medications, I was still struggling with anxiety. I still had those kinds of symptoms, but I think I had to figure out how to control my nervous system, which was huge.
And so what is so interesting to me is that when you're talking about the ketogenic diet, guys, this is not just, something that like, oh, just let me try it and see if it works. This is actually the most researched diet in regards to seizures. And there actually was a 2023 meta-analysis of randomized controlled trials of 575 patients, six randomized controlled trials that found higher rate of freedom from seizures and greater than 50% seizure reduction compared with controls. So we actually have that evidence, and there's actually quite a bit of evidence in the scientific literature. And I did want to ask you, when you were going through this and the physicians didn't even mention diet, stress reduction, nothing, how long ago was this?
This was in 2023. So it started in 2022 and it lasted until 2024.
Okay. So, and something else I want to point out, and again, I know I sound like a broken record, but I just need to say it. So, there is a 17-year time lag from when we discover something in the scientific literature to when it gets implemented into the standard of care. And it may never get implemented into the standard of care if implementing certain things may mean less medications being distributed. Okay. So I think it's interesting. Here we are in 2026, and neurologists probably still don't know about that 2023 study. And also, I did want to circle back around because we do talk about vaccines like all the time. I can't help myself. So you mentioned that you did get the COVID vaccine, and you just you didn't know, you weren't sure if it could be a potential trigger. I was curious about the timing from when you received a COVID vaccine to onset of seizures.
Yeah, so I got the initial ones in 2020 or 20, whenever they came out, like 2021 and then I got the booster though in 2022, I believe, because that's when I needed it for my contract. And that contract I was at for about 4 weeks. So anywhere from 4 to 6 weeks is about when I got the booster to when I had the the seizure on night shift.
Yeah, and that is something else I did want to highlight because again, and this is another this is some beef that I have, but you all know I have with functional medicine, is that in conventional medicine they don't want to talk about it, they don't want to acknowledge that vaccines are anything but safe and effective. That same thing is rolling over to functional medicine where people don't want to talk about it because it's deemed controversial. But that is something that I think is significant, that if you are a healthcare practitioner that is listening to this, when a young woman just starts having new onset seizures, we should be assessing all of the things. Okay, what is your environment? What are you eating? What have you been exposed to? What vaccines have you had? And again, with the COVID vaccine, there's so much we're not going to know. And I will say it was a shocker. They actually used a true saline placebo in those trials, which I was surprised by. But then what they did is they unblinded the group. So they went ahead and then vaccinated the placebo group. So now we don't have, they eliminated the placebo control group. So we're just not going to know the true risk. But I think that that is amazing. You were able to come off of these heavy duty medications. And when you were mentioning about the depression, and again, like we're humans, people are going to have life events that may cause emotion, it may cause sadness, it may cause temporary depression, anxiety, but it's not normal to have it all the time. And I remember I also used to struggle with severe anxiety. And I don't have I have zero anxiety now. I mean, I can go into like a party just completely by myself and just go talk to everyone, you know? And I think back to what I'm doing now versus before. And I wonder if some of those other issues I had were from gut issues and significant nutrient depletions. And this is something that, with depression and anxiety, and when it comes to functional medicine, we have been screaming from the rooftops that it's not just a chemical imbalance. I mean, that has been debunked. It is an inflammatory issue, it is a gut issue. A lot of these people have nutrient depletions. If you have gut issues, you may have nutrient depletions. And we know depletions in certain vitamins, especially B vitamins, can cause significant mental imbalances. And so I also wanted to ask, so I know our audience is curious. So you went ahead and you're living a healthier lifestyle. You are being more paying more attention to what you're putting in the body. How, like, once you implemented this, how long did it take for you to be completely seizure free?
Let me think. It was it was probably about 6 months that I completely didn't have any symptom, or I would get this aura like in it would go from my stomach to my esophagus, and it was like a circulating feeling. I don't know how to explain it, but I would still get those feelings even without a seizure. I would get like that aura of I'm going to have one. But it took about 6 months, I would say, of actually dedicating myself though and being full keto or full carnivore and taking care of my body. And it was probably a year from like in total, but 6 months where I truly didn't have any sort of symptoms or seizures.
And how long has it been now? How many years has it been now since you've had any seizures?
My last one was in May of 2024.
That's
So
amazing.
almost 2 years.
That's awesome. Yeah, oh, I love to hear these stories. It's so great. And I think this will inspire so many people because everyone knows someone that's struggling with something.
With
And
something, yeah.
yeah, I mean, like these things, they happen for a reason. If the body is seizing, it's so crazy to me that they were like, "Oh, it's it's okay, just let her seize. Just take these meds, you'll be
Yeah.
fine." And then in 6 months, you're able to resolve it just by being intentional with how you're taking care of your body. And do you have any follow-ups now with neurologists? Like, has anyone in the medical field anyone that has treated you, has anyone experienced, curiosity on how you're doing as well as you are?
Not really, no. I don't have a follow-up. I kind of disassociated myself from the medical industry for a little bit since then. I don't even have health insurance, but I'm so disillusioned by it because yeah, no, there was never any follow-up. It just wasn't good care, so I don't feel the need to. I mean, maybe they should know that none of the, medications they gave me worked, but what did work was changing my diet and lifestyle. Maybe they should know that, but yeah, I don't have any more connections with the medical system. I don't do follow-ups. I should get like a functional medicine practitioner or someone that if I ever needed anything, um, I would have it. But yeah.
Yeah, and well, I'm very interested in what you're doing now. So, can you tell us about the Realistic RN and your platform and the work that you're doing now?
Yeah. So I started the Realistic RN because I saw the corruptness. I was like, if I can do this and I was able to pull myself out of this depression, out of this anxiety, out of the system, basically, as a nurse, I want other people to know that they can too. And initially, I was just sharing my story. I was like, well, maybe my story will resonate with someone and they'll see it and they'll just see that they can do it. And then I started realizing it was more of a problem than I knew after I started sharing it online. And I started a petition about 9 months ago, I would say now, when I first started. And I think I was very naive to how complicated the system was. And so, but my petition, I am vouching for safe ratios for nurses. I'm vouching for real food in hospitals, for real nutrition education for nurses, or somewhere in the hospital. And I also am just trying to bring awareness to all, just nurses, healthcare workers, or just the general public who might sense that there's an issue in the healthcare system or knows a part of the healthcare system that's broken or knows that a lot of it seems to be like just a for-profit business model. And I've been just doing research and trying to bring the sources and the credibility and just showing people that it's okay to admit that the system is could be harming people. I think personally that what I was doing before was not what I wanted to be doing to help people. What I want to see is people being cured. What I want to see is people living a very um, healthy life. And what I was seeing in the emergency room was chronic health problems. It wasn't really emergencies. And I couldn't unsee it. I couldn't unsee it for myself. And I truly think that more awareness is the biggest thing that we could do for others, especially as nurses who see it all the time. And if you haven't experienced it as a patient, I think there's a whole different perspective from the patient side, bringing together both the nurse and the patient perspective.
And I am okay. So, if you are not driving, if you are able to look at Allie's social, and again, as much that I hate social media, it is a great opportunity for education, because there are so many nurses like Allie that are able to get their message out there via social. So again, it is the realistic RN, and I'm going through your IG, and these posts that you're doing. She's not just posting her opinion about things. She's very well researched. This is an excellent source of information. And you've just done so much here. I mean, you must be putting a lot of work into this education and advocacy. Out of all of, I mean, there's just so much here. Out of all of your research, what do you think is like the most shocking?
Um, Honestly, the hospital systems. I didn't understand the business model behind it ever
Mhm.
until I started researching it. And honestly, our history. Those two big things, medical history and the hospital system, have been the most shocking for me. Only because I didn't think that I knew that it was a business. I always knew it was a business, but I didn't think that every little thing was being monetized on, even
Uh-huh.
nurses.
You
Nurses are
have a
being monetized.
Oh yeah, no, it really it is such a predatory system, and again, like neither one of us would ever recommend someone avoid getting emergency care or unnecessary surgery or something like that. But we're talking about how the system is treating individuals with chronic illness, and so I remember when I was a nursing instructor, I would do pre-conference and in the cafeteria. And the hospital that we were at, they had a pediatric. It was a pediatric hospital, so there was an oncology ward, and I would see these little kids that had cancer down at the food court in the hospital having Taco Bell. And it's just really sad. Like it's just you just can't make it out. But you have a really good post here that says, "Here is what American hospitals give sick children." And then you say, popsicles, jello, juice, pudding, crackers. And then you said 969 hospital meals studied. Source clinical nutrition, ESPEN. 53% had sugar sweetened drinks. 2% met protein and fiber needs. And then you said, then we give them medicine. Children's Tylenol contains high fructose corn syrup, Red 40, Red 33, which are all petroleum based food dyes. And then you bring in common sense. Why don't hospitals feed kids real food? It's amazing. Like why on the earth? And I remember when I was working as a nurse, even before I learned about functional medicine, I remember having patients that just had a stroke or a heart attack. And we're like, well, here's your piece of chocolate cake and your Coke, and you're just loading them up with the worst foods. And it really makes me wonder. I'm like we do have a lot of people questioning the system, but what about the healthcare professionals that are not questioning the system and are digging their heels in? Have you received pushback for putting out such great information? Because again, it's excellent information, but it is opposing the current narrative. So I'm sure there's going to be people out there that are not going to like this.
Yeah, yeah, I've had a lot. I my account grew really quick, really fast. So initially it was all pushback. Initially, I didn't have much encouragement, I guess. Once the encouragement from others, once I started seeing that, oh, okay, other people are seeing this too. But I did have to push through in the beginning. A lot of pushback from nurses, doctors. And it was just confusing to me because in my mind, I'm not trying to shame anyone, and I'm not trying to put a, a shield over anyone's education and what they know and what they've learned. But I'm just here to say I think it's all a little bit made up, and I have evidence that it doesn't work. I have evidence of it, and as a nurse and as a patient. So it got to the point where the pushback didn't really matter anymore because people are it's just gonna happen. And I would say, I don't know if you think different, but maybe it's 70% of maybe 60% of nurses that still think that the system's working right, or maybe they don't think it's working right and they're too blindsided to see the other side, or that there might be something else going on. They just think that it's just a money issue and or a staffing issue. But I think the root cause of nurses being abused and understaffed and assaulted and kind of everything that my story paints is, you know, it's all kind of manufactured. And that's kind of what I'm preaching on my Instagram. And what I want people to know is our medical system seems to be manufactured for money and not health. And in that case, then it's not healthcare, it's sick care. This
And same thing with the insurance companies. A lot of people don't realize this, but insurance companies actually make more money the sicker that you are, because then they can charge more money for deductibles and things like that. And there's a reason why, insurance companies, they're so quick to cover drugs and things like that for you. But then when we have things that are validated, such as the ketogenic diet for seizure disorder, such as the use of acupuncture in chronic pain, things that are scientifically validated, they still would rather fund the pharmaceutical alternative. And but yeah, I think it's very interesting to me. I'm very interested in like the psychology behind those in the healthcare system that really think, yes, we're doing a great job with chronic disease, because we know this good and well as nurses. Physicians know this too. Once someone starts on one drug, it's a matter of time until they need another medication. And we don't see these people with chronic illness get better. We tend to see them just get worse over time. So, well, that is about all the time that we have today. But I did want to ask, so if our listeners want to find you, where are the best places that they can go to learn more about you and your work?
Yeah, so Instagram is my biggest platform at The Realistic RN. TikTok I have as well at The Realistic RN. If they want to tune into my podcast, it's The Realistic Nurse Podcast, both on Spotify and YouTube. And I will have a new website coming out soon. It'll be therealisticrn.com, and that will have resources and my petition. If you guys want to sign my petition, I encourage that, for real food in hospitals, safe staffing for nurses, and just truthfulness within our healthcare system.
Wonderful. So I will be sure, I'm going to post all of that in the show notes. So please be sure that you check out her petition and check out all the great work that Allie is doing at the Realistic RN. And again, we really, really need to support nurses that are out there telling the truth. And I really do think that you're going to make an impact. And I love that you are using social media in this way to spread education, truth, and awareness. So thank you for coming on the show. That is all the time that we have today. Thank you so much for tuning in. And again, if you want to learn more about the Functional Nurse Academy, please feel free to register for our next live webinar, and you will see that link in the show notes. You can also check out Functional Nurse Academy on our social media platforms or on our website at functionalnurseacademy.com. Until next time, be safe, be well, and God bless.